Hello everyone, you're welcome back to this channel. My name is Selena of Duty. If you're new here, please do subscribe to this channel. All right, so I'm here this morning to talk about the crunching healthcare system in Canada as we speak right now. There's a shortage of nurses everywhere. There's a shortage of nurses in the hospital. There are shortage of nurses in the nursing homes. There are shortage of nurses in the community. So I'm using this channel to broadcast this message to all well-trained health professionals all over the world. No matter where you live, if you live in Europe, if you live in North America, if you live in Nigeria, doesn't matter where you live, if you're a healthcare professional and you're trained, please do come to our aid, because the future of this healthcare is at stake. There are no nurses in the hospital. The emergency departments, some of them are shutting down their doors to patients. And what does that tell you? This is not good for the Canadian healthcare system. And this is not good for the people as well. Imagine you shut down your your emergency department to patients. You know, those patients might be you, might be your family members, might be anybody. You close down your doors to these people to come in and get the healthcare that they need and also get the healthcare that they deserve, and you tell them, we don't have staff. We don't have staff. We don't have staff to take care of you. We don't have staff to give you the necessary treatment that you deserve. What does that mean? You know? So this is outrageous. This is becoming too much. The ones that are left, the few staff that are left, are overburdened. They are overburdened by these hospitals, by these long-term care facilities. They work too hard. They're working too hard. They work so many shifts. They work so many shifts at a time. And guess what? What happens if you do so many shifts at a time? If you work too hard, if they're forcing you to come to work even when you're sick. You have to work when you're sick because there's nobody, there are no healthcare professionals out there, you know, not that much to take care of this patient. And you're sick. How can a sick person look after a sick person? It's not possible. It's not possible. The few ones that are left here, the few staff that are left here, they are working too hard. They gave them too many patients to look after. And what happens when you look after too many patients at a time? We are all human beings. We are bound to make errors. Please, we do need healthcare professionals. Okay? So go online and apply to become a health professional here in Canada. I don't know how the system works, but just, go and try. Go and try and put in your application and go through the process. And please do come to our aid. Do come to our aid, because nurses are working way too much. Okay, so it's very unheard of. A country such as Canada is closing their emergency department for their people to come in and take the necessary treatment that they deserve. You know, this is not good. You know. Most of the nurses here, the new ones, even the new ones that are, new nurses that are being trained, some of them, at the end of the day, when they see how the system works, that the system does not favor them, some of them leave. They leave. Some of them leave to a better place where they can be better cared for, where they can have a better pay. But what is the government of Canada doing about this? Since the pandemic, we have been working so hard, and up to now, we were thinking maybe by now things would change, but not even a budge. Nothing has even budged. Nobody's doing anything about it. So I'm here and I'm advocating on behalf of other nurses that are working too hard for new nurses to come to our aid from all over the world. All right? So thank you guys. So please do share this video, do subscribe, so you'll be the first one to get my video when I upload them. Thank you. I'll see you in my next video.